Assalamu alaikum. Hello, my name is Dr. Bushwereb. I'm a family doctor GP from UK, and today I'm going to present about menorrhagia, heavy periods. The reason I've chose this subject because it's very common, and if you didn't come across my channel before, the reason I've opened this channel just to increase awareness about common cases family doctor sees. Let's go straight to the symptoms. The periods are heavy, they might have clots with them, they might also have pain, and the pain is usually in the lower tummy and also in the back. So if you have this problem and decide to go to your only family doctor or your gynecologist, your doctor would like to get more information about your period. So for example, how long is your period? Is it like 4 to 5 days, or is it like 8 to 9 days? Because having like heavy periods and clots like for 4 to 5 days is not like if you have it like for 8 to 9 days. So that can be much harder, and it can cause even much frustration for a patient if her period is up to like 8 to 9 days, especially if somebody is having even like low mood and anxiety prior to her period, because there's a condition called premenstrual tension syndrome, and that's where a girl or a woman, she feels like really tense and stressed and low, and she also suffers from low mood before her period. So imagine on top of that, and also like she's having like a really heavy period for 8 to 9 days. That can be really frustrating and difficult to handle. And is your period, is it regular or irregular? So when your doctor is asking this, they're thinking, well, if it was regular and then suddenly became irregular, and you're in your late 40s, well, it could be maybe you're going through menopause. Or if it was like regular also again and became irregular, it might be like you're developing a problem with the thyroid gland. Maybe it's becoming underactive. Or if it was like irregular from the beginning, you might be suffering from polycystic ovary, but it wasn't diagnosed. And then also your doctor will ask about your skin. Did you notice that your skin is becoming pale? Do you suffer from any hair loss? Or did you notice also like your nails are brittle and they broke very easily? So what are the red flags? For any symptom you present to your own doctor, they always have to exclude red flags. When I say red flags, that means serious things such as cancer or anything else which needs an urgent referral, a 2-week referral, or an admission. So what are the red flags in case if somebody is having heavy period? Well, do you have any bleeding between your periods? Even if you had an irregular period, but is there any spotting between their periods? So that's a red flag. Another thing, did you notice any bleeding after sex? So if somebody asked yes, so that means you need actually a 2-week referral to exclude cervical cancer, and the 2-week referral will go to a gynecologist. But that doesn't mean that you have cervical cancer. It just means that it needs excluding. Most likely, it will not be cervical cancer. Most likely, it could be maybe a bit of hormonal changes, maybe a bit of thinning of the genital area. Could be maybe your own contraception. Could be trauma. It could be other more common conditions or more common reasons. Behind it. It's just like your doctor is being safe, protecting you, and also like protecting like the doctor has to the doctor is working in the best interest of the best interest for the patient. Okay, so if your doctor thinks that you might be going through menopause, she will ask you other things like, do you have hot flushes, night sweats, mood swings, any change in your skin or hair? Menopause, it can be different from family to family, from a woman to woman. Some women, they go through menopause in their 30s because their families went through menopause in their 30s, and that's called premature menopause. And some women, they go through menopause in their beginning of their 50s. So yeah, if you have like a heavy period and your period has changed, so it could be maybe like menopausal, and that's natural process. It's not a disease or anything. It just means that your ovaries are not producing that much estrogen as before, and the progesterone is also dropping. That is it basically. How having a heavy period, it can affect a woman or a young or a girl socially and mentally. It can really affect. It can cause frustration, because imagine if somebody has to like change the pad like every 1 to 2 hours, and if she has flooding, if she has clots with it, that can make you like self-conscious, you're worried in case like if you wear something, if somebody will notice, if there's any flooding or bleeding, and even like it can affect, it can prevent you maybe going out like to social events, or even it can affect sometimes a relationship with your husband or partner. It can cause stress and anxiety and even low mood. So what are the causes? As we mentioned earlier, the thyroid, if the thyroid is underactive, that's one of the main causes. Another thing is polycystic ovary. So if your doctor thinks, well, it could be polycystic ovary, she's going to ask you, do you notice that you have any weight gain, any acne, any hair loss, any increase in facial hair? Fibroids, also one of the common causes, and fibroids are benign tumors of the uterus. Another thing, which is most common one, is age. The uterus by age gets bigger and bigger. That can cause more bleeding during the period. And also, like as I said, going through the menopause, like because of all of the change in the hormones. So if your doctor thinks that, well, you might like have heavy period, and after like taking the full history, and then she's gonna like fully examine you. She's gonna look in your skin, check your hair and check your eyes, look for any signs of anemia, and then gonna examine your tummy, make sure you don't have any lumps, like as I said, like because one of the causes, it could be maybe a fibroid, or it could be even polycystic ovary. So she's gonna look for any lumps like cysts in the ovaries, and then your doctor will do an internal vaginal examination, especially if you answered yes on those red flags, and the reason behind it just to exclude cervical cancer. The blood test, thyroid has to be tested, and then also the polycystic ovary syndrome, the test for it will be like checking two hormones, the LH and the FSH hormone. If the LH, so I want you to focus on this point if you think that you might have a polycystic ovary. If the LH is higher than FSH with 3 times, okay, that confirms polycystic ovary. If it's not higher, higher with 3 times, so that doesn't confirm polycystic ovary. Sometimes the patient has their agenda. Sometimes they want an ultrasound, and they fight. Some patients they fight for an ultrasound for the diagnosis of polycystic ovary. I want to tell you that that's not in the protocol in the UK anymore. So, for example, if your GP writes in the request for an ultrasound of a polycystic ovary and send it to a radiologist, to secondary care, the radiologist can decline that request and can say, well, that's not appropriate because an ultrasound is not a diagnostic test for polycystic ovary syndrome anymore. It has to be a blood test, okay? And that's the reason behind I opened this channel, just to let you know about it, because that's what GPs always struggle with every day, like with patients needing their agenda, needing extra tests and extra. So it's not that your doctor doesn't want to do it. It's just like if they're going to do it, it will get rejected from secondary care. So that will just waste your time and waste the time of the doctor and waste the time of the radiologist. So the other thing, of course, full blood count, ferritin, that to exclude like any anemia, and the ultrasound can be used, but that's if your doctor thinks you might have a fibroid in the uterus. And as I said earlier, fibroid is a benign tumor of the uterus. So the treatment depends on the cause. So if your doctor thinks, well, you have a problem with the thyroid, then they're going to fix that. If they think you have a polycystic ovary, they're going to go through all of the treatment of polycystic ovary and maybe even refer to gynecology. If they think you have a fibroid, again, they're going to refer to gynecology, and then gynecology will discuss with you about the treatment of fibroid, whether they're going to follow watch and wait approach, or whether they're going to treat it, maybe like even remove it, surgical. So if your doctor didn't find anything and it's just that you have a heavy period, so the options are, it could be tablet, or it could be maybe hormonotherapy, which like, for example, like a coil, a contraception. So the first tablet we usually use, following the national UK guidelines, are non-steroidal anti-inflammatory drugs as ibuprofen or mefenamic acid. Mefenamic acid works exactly like ibuprofen, and scientifically proven that really reduces the pain and the bleeding. So usually the first option, like the non-steroidal anti-inflammatory drug, this one, that usually is used for teenager girls who don't want to go on hormonotherapy, who just want like something as a tablet just to help with the heavy periods. The other option is tranexamic acid, and that reduces the bleeding more than ibuprofen and mefenamic. You can take it only for 4 days, and then after that you have to stop it after 4 days, 3 times a day. the only disadvantage with it, as we know, all drugs, they always have positive things and they have negative things. The disadvantage that it might increase the chance of clotting. So that's why if you have any personal family history of clotting, my advice not to take it. But again, I'm going to leave this discussion between you and your own doctor. The third thing will be hormonal therapy, which is contraception. As we know, contraception, there's tablets and there's the coil, the hormonal coil as Mirena coil, which has progesterone in it. So Mirena coil actually is really good for women on heavy periods, especially if they have their kids, they have 3 or 4 kids or whatever, and they don't, or if they had like a kids and they want to have like a gap between children, having a Mirena coil actually is really good. It can treat the anemia, it can treat your period, treat all of those problems, and at the same time it is a contraception. Of course, Mirena coil has its disadvantages, as I mentioned. Each medication has. So one of the most famous things with Mirena coil, that it has like irregular bleeding in the first 6 months up to 1 year, but after that the period should stop, and then after that you're gonna get all of the advantages. Sorry, I couldn't go in details about contraception because that will take like a whole video. And I'm trying to keep my videos a bit short. So if you have any questions, please leave them in the comment section. Please share, like, and subscribe, and share with any of your friends or relatives who you think they might have this problem. And thank you very much. Salam.